about. Now we got our good buddy, Dr. Kavanagh. You're our go-to guy. This morning, the big story, and sometimes we pick out these things that are stories for glory because they're making the news, and sometimes they're not all that important. But the big story for glory this morning is that the vice president was not wearing a mask yesterday when he was touring the hospital, and they had actually told him that he was going into an area where he needed to wear a mask, which that strikes me as odd.
Well, it is, and this is a little bit different than me or you not wearing a mask outside when people aren't around. He was in a hospital, and the type of mask he would have been given would have been probably an N95 or a surgical mask, something that actually could filter out the virus. Certainly, if I was making rounds in the hospital which had COVID-19 patients, I would at the very least be wearing a mask. We really can't forget what the Prime Minister of England went through. You can get COVID-19, and in some respects, this is even a national security problem. I mean, I've had some problems with him and the president being in the same room together. And also, if you go through the hospital not wearing proper protective equipment, it's a safety problem for yourself. And I think a lot of people still are mitigating or making less severe the importance of this epidemic. And I kind of get this idea from listening to some of our leaders. This is a very infectious virus. The virus can be very deadly. And yes, if you talk about the aircraft carrier that's filled with people under the age of 30 and many under the age of 20, you're going to have a lot of asymptomatic carriers. But even on that aircraft carrier, they got very sick. Overall, from what I can see, the fatality rate is close to 1%, if not over 1%, when you adjust for biases in the data. And they've already adjusted for the asymptomatic carrier rate. And that carrier rate is why wearing masks are so important. We've been talking about this for many weeks now. And the governor this week has come out with guidance that he feels everybody should wear masks. And of course, I've said that about food handlers. Now you have Kroger, Whole Foods, and also Walmart are having all their employees wearing masks. And people coming into those areas should also be wearing a mask. And masks are not primarily to protect the person. And here we're now talking about the do-it-yourself masks, the cotton masks, because they do not do that good of a job of filtering out viruses. Will it protect you some? Probably. But if you get close to a COVID-19 patient, your chances of getting the infection are fairly high. What they do is protect other people from getting the virus from you, because you can be carrying it and not knowing it. And that's what's very important. And so I would suspect that if this epidemic continues, and I hope it does not, I hope it dies down in the summer, that employers will more and more be requiring patrons to wear masks to protect their employees. And I should add that I feel that food preparers, such as people making sandwiches and pizzas, etc., for you to pick up, should be wearing masks also. That's one of my pet peeves. But I do think we're going to be going there as a society as more and more people see that we have to wear masks. The other thing that really is getting to me is the lack of realization that this virus doesn't respect geographic boundaries. So it makes little sense having counties or cities doing their own separate thing. The virus will spread. It spreads because of asymptomatic carriers. Even in Kentucky, we have counties in the rural areas, especially in the western part of the state, that are having a high degree of infections. And that to me is very disturbing. If you look at Hopkins County, they have 21 people who have died, 190 confirmed cases, and they have a population of 46,000. So just because you live in a rural area doesn't mean you're not going to get this. We have huge outbreaks in New York City. Everything I read in that area is just heartbreaking. We have large outbreaks in Boston and also, of course, in New Jersey. There's no reason to think that that won't happen here. Einstein said the definition of insanity is if you keep doing the thing over and over again and expecting a different result. So I would certainly recommend following the governor's advice. Please do that. I think that is extremely important. He has been very good. He's getting national and international notoriety and acclaim for how he's kind of calming the populace and getting people to stay safe at home and to abide by social distancing means. But one of the big things we need to make sure that we're doing is to continuing to do this while the epidemic is starting to wane. We don't want to get into what's called isolation fatigue, where we start not doing social distancing and we see the virus start to reemerge. That would not be good. Today, unfortunately, we are going to break 60,000 deaths. And the vast majority of those occurred within the last 1 month. 50,000 of them did. And this is with social distancing. So this is a dangerous epidemic.
We had Senator Rand Paul on yesterday. He said it depends on where you're coming from and all this kind of stuff in life as to whether or not you ought to be wearing a mask. He said something like, I think he said if I were a 26-year-old healthy young man, I probably wouldn't wear one. And I got to thinking about that afterwards and thought if you could be asymptomatic with this disease, then that means a 26-year-old man who is healthy but has the disease could be going around infecting other people. And that seems very selfish to me.
Well, that is a problem with younger people. And that's why the aircraft carrier example was not really applicable to the general population. The younger people, I believe, even though they don't have symptoms in a lot of the cases, the vast majority of the cases, they will spread the virus. Now, I should add that everybody concentrates on death rates. Younger people can get extremely sick from this, and this virus doesn't just affect the lungs. It affects every organ in the body, well, practically every organ. And we've seen that people are getting strokes, they're getting heart disease, you can get pulmonary fibrosis, and all of this can give you lasting health problems. It's not that likely to happen unless you're sick enough to be in the hospital. But if you do get sick enough to be in the hospital, and right now you have to be pretty sick with dyspnea or shortness of breath, you can have lasting health problems. So to mitigate the severity of this epidemic, I do not think is very, very wise. And of course, as I've just stated, the virus doesn't respect geographic boundaries. I mean, they had no problem going from China to Europe to the United States, even with travel bans enforced. It sneaks in, it spreads fast, and that's why we have to be very, very careful. And it's not just the elderly. The younger people will indeed be able to get this infection, to spread it, and they can become very sick with lasting health problems. The other problem is immunity. You know, people were saying in the onset, well, this is just the common cold. We don't have to worry about it because there's coronaviruses that cause the common cold. Well, we've seen that these viruses are more deadly than the common cold. But one of the things we're worried about is whether or not the immunity will last longer than the common cold. Common cold viruses, the immunity lasts only 1 to 2 years. And so we need to really think, do we want to go through this again in 2 years if we really get this virus out in the community, and if we're going to go back to normal? And I don't think we're going to go back to completely normal until we get a vaccine, and that's what I'm hoping for.
All right, I'm out of time. I did want to share with you the Auto Tech Service text line. Someone wrote in and said Dr. Kavanagh had a great op-ed in the Herald Leader that really ripped into the profit hospitals and their choosing profit over preparedness. When did that run?
That ran, I believe it was Monday. We've had quite a lot of national reporters that have actually called. And there was one report in the Washington Post. That report was actually spurred from a previous piece we had on it with MedPage Today. So we've got a lot of more information I think will be coming out on that subject with these national investigations that are ongoing.
Very good. We'll talk to you on Friday. Thank you, Dr. Kavanagh.
Thank you very much, sir.